So the lowest level is where we have clinicians who are classified as physicians, nurse practitioners, and or physician assistants who have 30-minute visits with patients, each costing $100 if it's education only, or $200 if it's actually a clinic visit. In the clinic visit, the minimal is talking with the patient about their medical history and whether or not they have had cancer, so that the visit is customized to preventing heart disease in folks without cancer versus preventing heart disease in those with cancer. And then, of course, also for those with cancer, talking about how preventing heart disease helps to limit issues with cancer itself. And that's the lowest level with no prescription of medications. And folks can have as many of those 30-minute visits they want. So that's the lowest level. And then the next level up is, so if there are companies that are comfortable with only that for a nationwide telehealth company, or only that for a telehealth company in whatever states they choose to cover, that is fine. Then the next level will be for companies that are willing to cover more risk. And so the next level then would include prescribing medications for said purposes. Then the next level up for companies that are comfortable with more risk for a telehealth company, whatever states they choose to cover. That level now would be not only preventing, but managing heart disease. So managing heart disease in folks with cancer, managing heart disease with folks without cancer. And also recommendations can be made that the primary care providers and oncologists and so on can follow, and in which case we can still have that level without prescribing medication, simply making recommendations for managing the heart. Then the next level up from that for companies that are willing to cover more risk is all of that plus prescribing the medications directly instead of making recommendations only. So those are really the four levels, the four tiers for which we've been looking for coverage. And as I mentioned in one of the descriptions, the goal is telehealth nationwide.